The Committee of Ministers is the primary institution of the Council of Europe. So now that the Committee of Ministers has pronounced itself on sexual orientation and gender identity, that means that we've reached really high up within the institution. Okay. In March 2010, the committee adopted a recommendation on measures to combat discrimination based on sexual orientation or gender identity, which is the first instrument of its kind in the world, dealing specifically with sexual orientation and gender identity in human rights law. Okay, so this is a first on many fronts. So what do these recommendations deal with? They deal with the right to life, security, and protection from violence, covering hate crimes and hate speech, freedom of association, freedom of expression and peaceful assembly, the right to respect for private and family life, employment, education, health, housing, sports, the right to seek asylum, national human rights structures, so equality bodies therefore, and discrimination on multiple grounds. So basically they cover just about the whole spectrum of life, which is very interesting. Now, as a word about the process here. So when this was happening, okay, there were many steps to this. This is not the ultimate human rights document ever. There were many people who, during the process, did all they could, and many countries, therefore, did all they could to bring the impact of these recommendations down. So if you see what how Russia was acting if you look into that, how Russia was acting while this was being formulated. If you also see how the Holy See, which is the Vatican, was acting while this was being formulated, how they tried to influence all countries to bring the language as down as possible, you will realize that, of course, this document cannot be the whole thing that we would like to see, okay? Nonetheless, it is still a very useful document. For today's session, I've only put here the recommendations related to healthcare, which I know are primary importance to the trans community. So we will go through the recommendations, this section only on healthcare. So you see how many recommendation sections there are. We will be dealing only with the healthcare section. And we will also be going through the guidelines that the ILGA Europe set of guidelines provide you already, all right? So there is this legal text that may be very difficult for you to implement at the moment, but then there is also a tool that you should help you use, come to a few answers about the situation in your country. This is the first recommendation of 4. Member states should take appropriate legislative and other measures to ensure the highest attainable standard of health can be effectively enjoyed without discrimination on grounds of sexual orientation or gender identity. In particular, they should take into account the specific needs of lesbian, gay, bisexual, and transgender persons in the development of national health plans, including suicide prevention measures, health surveys, medical curricula, training courses and materials, and when monitoring and evaluating the quality of healthcare services. So that is a major recommendation there already, okay? And you can already, I'm sure, start to assess your country's situation in terms of this recommendation, and therefore how much each and every country needs to do to ensure this recommendation. The second recommendation doesn't have an impact for what we're discussing in this room, primarily because of the ICD situation where gender identity disorder is still in the classification. They did not want to deal with that. So this says appropriate measures should be taken in order to avoid the classification of homosexuality as an illness in accordance with the standards of the World Health Organization. So they skipped the whole gender identity disorder issue altogether here. 35, which is the third recommendation in health, member states should take appropriate measures to ensure that transgender persons have effective access to appropriate gender reassignment services, including psychological, endocrinological, and surgical expertise in the field of transgender health care, without being subjected to unreasonable requirements No person should be subjected to gender reassignment procedures without his or her consent. Okay. The last recommendation, member states should take appropriate legislative and other measures to ensure that any decision limiting the costs covered by health insurances for gender reassignment procedures should be lawful, objective, and proportionate. So these recommendations have a lot of impact, I think, for all of you. And now you start to see how useful they in fact are in your domestic advocacy. If you're advocating for your, I don't know, Ministry of Health's inclusion of transgender health more prominently in their program, right? This is the set of recommendations that you should be taking along with you and saying, our government has agreed to this set of recommendations. What are you doing about it? Right? In monitoring the implementation of these recommendations, we also suggest that you don't only use them to criticize in the sense you, I don't know, go on public television and say it's outrageous that our country is doing nothing on this front, you know, we're almost a third world country, we should be doing, you know, that sort of language can work, but it's not the only way to do it this time. There is more that you can do. So you can actually, without waiting for that moment when you're on public television saying those words, you can already approach the relevant ministries, you can approach the relevant persons in government and say, these recommendations have been approved in 2010 already. A year and a half have passed. In a year and a half's time, our government will have to give some form of account as to how it's implemented these recommendations into domestic policy to improve the situation of trans people. How can we make sure that in a year and a half time, our government will be able to say a number of measures that it has taken to ensure progress for trans population, okay? So let's now go into the guidelines that we have put together. I will send both the recommendations and the guidelines as links to Richard for you to all access after the session. So this is the first recommendation that we dealt with, ensure the highest attainable standard of health, okay? So this is, I have two sets of questions there already for that one recommendation. So do the design of national health plans, health surveys, suicide prevention programs, medical training programs, training courses and materials, the monitoring and quality assessment of healthcare services take into specific account the needs in relation to sexual orientation and gender identity. So do all these plans, surveys, you name it, okay, have firstly considered gender identity and sexual orientation. If they have, what actions have they taken to advance equality on the ground of sexual orientation and gender identity, and what are they now doing positively to make sure that if, say, trans people are more subject to experiencing suicidal tendencies, that there is a prevention program, etc. Okay, so there is a lot for you to already use, and also to bring up in these conversations that I'm suggesting that you have. Okay, so the moment you meet up with the ministries, you don't only say what are you doing about this, but you can already have a list of things that you want them to do based on these recommendations. And these questions that we have formulated are as generic as they can be, okay? You can make them more specific to your country. So if you know that there is a particular policy, you can already link up to that policy elements of these recommendations, okay? So it would be more useful for you, instead of saying the national health plan, if there is not one but several plans, okay? You link up to the specific health plans. Again, if training courses and materials, which ones? Okay, maybe you know exactly which ones and what should be in the curricula of them. Okay, it would be more useful for you to be as specific, as concrete as possible, because they may not think as far and also in the way you work, because you have the knowledge, not them. So try to also use this as an opportunity to engage with them. A follow-up question to that one: do training programs for health professionals enable them to deliver the highest attainable standard of healthcare to all persons with respect to, for sexual orientation and or gender identity? So once more, another question there for you to use. Are education, prevention, care, and treatment programs and services in the area of sexual and reproductive health available to LGBT people, and do they respect their needs? So 2 questions there: availability, and then respect the needs of trans people. Okay. Are health professionals and social workers encouraged to create an environment that is reassuring and open to young LGBT people, for example, through information campaigns? Are patients in hospitals and otherwise the subject of medical emergencies free to identify their next of kin, and are rules on issues regarding next of kin applied without discrimination on the ground of sexual orientation and or gender identity? So many questions there to be asked about this one recommendation. I think it's very useful. I really think it's very useful. In some countries it will be very difficult to address, because if there are bits and pieces of policy, okay, but not quite as far as you would like them to be, you will already first have to identify the bits and pieces of policy that already exist, and then try to develop them further and also make suggestions and proposals. In other countries, I don't want to mention any one country in particular, but those who come from those countries will know not too much already applies in national policy making, okay? So you can already skip the stage of trying to scope what is already in place and what isn't, and go straight to the point and say, we want you to do this list of things based on these recommendations that our government has approved. The third recommendation out of the 4, okay? Member states should take appropriate measures to ensure that transgender persons have effective access to appropriate gender reassignment services, including psychological, endocrinological, and surgical expertise in the field of transgender healthcare, without being subjected to unreasonable requirements. No person should be subjected to gender reassignment procedures without his or her consent. Okay? So the guideline: do transgender people have effective access to appropriate gender reassignment services, including psychological, endocrinological, and surgical expertise? If it was the practice to make transgender persons undergo therapy to accept their birth gender, has this practice now been abandoned? Have measures been adopted to ensure that no child has their body irreversibly changed by medical practices designed to impose a gender identity without his or her full, free, and informed consent, in accordance with his or her age and maturity? I think this last one is related also to intersex people, so it's interesting in that sense. So there are 3 questions there, again, for you. These are fairly yes-no sort of situations. Of course, often it will be yes, but, and it's the but that will matter. In other instances, it will be no, but, once more, and that but will matter. But, of course, you will need also to make sure that the recommendation is fully implemented. Then, a recommendation related to cost coverage. Member states should take appropriate legislative and other measures to ensure that any decision limiting the cost covered by health insurance for gender reassignment procedures should be lawful, objective, and proportionate. Where legislation provides for the coverage of necessary health care costs by public and private social insurance systems, is such coverage for gender reassignment treatment ensured? If yes, is it ensured in a reasonable, non-arbitrary, and non-discriminatory manner? Here, I think it's one thing to say, not all my costs were covered, okay? That's the simplistic approach that you can take about it. But if in your country many other treatments also don't receive the full coverage of costs, then it's very difficult for you to make the case of receiving full coverage of costs, okay? It depends, therefore, from one country to another. And also, in some countries, insurance companies have more of a social role to play, in others not so much. So I think it's the Netherlands where the, correct me if I'm wrong now, but I think the insurance companies, you have to have an insurance, right?
Yeah.
In the Netherlands. And then the insurance companies also are obliged to cover a certain list of medical needs, okay? That's one model, but it's not like that in every country. In some countries, the national healthcare system takes care of itself already without needing a private insurance. So there would be a public form of insurance, social security mainly. And in other countries, therefore, when you access private insurance, it's at their rules, their way, by and large, because you sign up to a contract with them, and once you sign up, you've agreed to. It's like a private contract with them, right? So that's a different model. It's when the healthcare costs are covered by the public or are agreed between the public sector and the private sector, I suppose, is when this recommendation is most useful, okay? But again, this is very helpful, for example, in the Dutch context or any other context. Surely, in all countries where healthcare is covered by the state, there should be an assessment there of other sort of medical practices, what is covered by the state, what is not covered, why is this, for example, partly covered or not covered at all. In this presentation, to wrap this up very quickly, I tried to firstly give you some background knowledge to what human rights law is. It's really extensive, and you need to spend quite some time to get a grip with all of it. Nonetheless, you don't need to do that in order to start using it. So already start using what you already know. And it doesn't matter if you use it, if you use the wrong recommendation. It's better to use the wrong recommendation that is useful for you than not use any. Because the difference is that the moment you step into a room and you say, I would like to see you do this, that's one thing, all right? I would like to see you do this because if you don't do this, you're failing your promises at the Council of Europe, at the UN, at the EU, wherever, all right? You're failing to implement this domestically. You're giving us a bad service. That's a different way of speaking. So refer to these recommendations, refer to the human rights law that is available to you, because it's only like this that you will advance your cause nationally. And then if you need guidance, please don't hesitate to ask also. Some of you do it on a regular basis, and we do provide input as fast as we can, not always immediately, but surely we do. And also do not hesitate to report cases of discrimination. So the email address for that is still active. It's directives@tgeu.org. So report cases to that one. Your cases, your reports have been very useful in helping the formulation of the joint submissions between ILGA Europe and Transgender Europe. I think we're doing a very good job with those reports, because we are not only highlighting the problem to the Commission and to the institutions, but we were actually showing concrete examples and concrete situations of people who are being discriminated on the ground, and they have impact. So do not hesitate to input also into that process. But also, importantly, do not hesitate also to send emails, letters, you name it, to the institutions as well. The more they receive complaints about an issue, the more they have to act about it. So if you look, for example, at the report on the implementation of the Charter of Fundamental Rights of the EU, they actually report how many requests they have received from, say, gays and lesbians, or homeless people, or older people, you name it, okay? It would be great if there would be a section, trans people, and the percentage related to it, because the moment this number of complaints increases, then they really have to do something about it specifically and not just a word here and there in some document, all right? So that's it, I suppose, for this session. The presentation is somewhat longer, so you will have the ability to scroll through it and see more. And when you have it, it's actually here, so it can be disseminated after. Yeah.